When you immerse your body in cold water, several systems activate at the same time. The first is the nervous system. Cold exposure immediately stimulates the sympathetic nervous system, increasing alertness, heart rate, and norepinephrine. That initial stress response is normal. Over time, with appropriate dosing, some people see improved parasympathetic tone, meaning better stress recovery and resilience. Cold also affects inflammation signaling. Blood vessels constrict in response to cold and then dilate afterwards, which can temporarily reduce pain and swelling. This is why ice has traditionally been used in sports medicine. However, inflammation is not always the enemy. Cold exposure also impacts metabolism. It activates brown adipose tissue, which increases heat production and energy expenditure. There are also real neurochemical changes. Cold exposure increases dopamine and norepinephrine levels, sometimes for hours after immersion. This likely explains why most people report improved mood, focus, and motivation after a cold plunge. These effects are measurable, not just placebo. Studies have shown that cold water immersion can improve perceived stress tolerance and mood in certain populations. Dopamine levels can rise significantly after cold exposure, which may contribute to antidepressant-like effects in some individuals. Cold exposure is a stressor, and if your stress response is already dysregulated, adding more stress may not help. When it comes to muscle recovery, the research is more nuanced than social media really suggests. Cold plunges can reduce some soreness and pain perception. However, frequent cold exposure immediately after strength training may blunt muscle growth by interfering with inflammatory signaling that's required for adaptation. This doesn't mean that cold plunges are bad. It means that timing matters. Using cold strategically is very different from using it reflexively after every workout. Metabolic studies show that cold exposure can improve insulin sensitivity and increase energy expenditure. But these effects are not dramatic and should not be viewed as a substitute for nutrition, sleep, or regular movement. Cold exposure tends to work best for people who have some physiological reserve. Athletes often benefit when cold is used strategically. Some people with mild insulin resistance or low motivation benefit from the neurochemical effects. Certain individuals with low-grade depression may notice improvement. This is where caution is critical. Cold plunges can worsen symptoms in people with things like chronic fatigue, long COVID, mold illness, significant dysautonomia, untreated hypothyroidism, very low cortisol output, or severe anxiety or panic disorders. If you feel worse after a cold exposure, that is not weakness. That's a physiological feedback that your body is giving you. Your body is giving you information, and it deserves to be listened to.